Healthcare is something we all need at some point or another and is often unanticipated. A fall on the playground, a car accident, a sudden illness or diagnosis may dictate our need for healthcare, but at what unavoidable cost? Medical bills frequently lead to debt and other financial consequences that harm patients and their families. What's worse is they can't necessarily prepare for those costs. When you go to the grocery store, you can see the price of what you're buying before you get to checkout. But in healthcare, patients don't know the cost until after services have been provided. The Centers for Medicare and Medicaid Services, or CMS, has started to address this. In 2021, the agency put a rule into effect that required hospitals to post their prices. However, results have been mixed at best. Many hospitals have failed to comply, or the information they have provided has been exceedingly unclear, difficult to find, or impossible to access and use. While compliance has improved over the 2 years the rule has been in effect, independent reports estimate only 36% of hospitals are fully compliant. In addition, the enforcement mechanism is sporadic and weak. In fact, CMS has issued over 700 warning letters, but only 14 penalties, and it's not clear whether those warning letters have changed any hospital's behavior. We know when prices are publicly available, there's more competition, less price gouging, and fewer artificially inflated prices. Consumers should be able to shop around and compare healthcare prices before getting treatment whenever possible. Hospital associations and health systems claim that complying with the rules is expensive and difficult. However, some hospitals have shown that it's not that hard to post their prices. Take Lake District Hospital in Oregon, for example. Immediately on the homepage of their website is a bright green price transparency link that brings you to their page with the required prices. You can see the price of services for various insurance plans with clearly identified codes and services. It's easy to find, easy to read, and easy to use. Yet, as we've seen, not every hospital has managed to achieve this. While CMS recently made updates to the transparency rules in an effort to make posted prices easier to find, Congress has also taken notice, introducing several bills that all focus on the same issue, putting stronger price transparency requirements into law. This includes expanding requirements to post prices to providers other than just hospitals, and strengthening the monitoring and enforcement mechanisms for transparency compliance. Every American deserves to understand the potential cost of a medical bill before getting treatment. If we're going to protect patients and lower healthcare costs, we need to improve price transparency throughout the healthcare system, including from our hospitals. Take action and learn more about how you can help at PIRG.org.